We were happy to have an oral abstract this year looking at Venetoclax use in chronic myelomonocytic leukemia. So the mainstay of therapy for CMML is hypomethylating agents, HMAs. And this is based primarily approvals based on a very small amount of patients included in phase 3 trials where it was approved for MDS. And Venetoclax has been utilized extrapolating data from AML and MDS, although dedicated CMML studies are not really reported. In addition, we know that BCL2 inhibition may be less effective in patients who have monocytic phenotype of AML, and so it goes to show that maybe Venetoclax isn't as effective in CMML. So what we did to answer this question is we performed a multi-center 4-institution retrospective study of patients who were treated with HMA Venetoclax, and then what we did is compared them to patients who were treated with HMA alone, and we really isolated patients who were treated in the frontline setting to minimize any bias. And what we showed is that response rates were significantly higher with HMA Venetoclax versus HMA alone in a propensity score match analysis versus when you look at HMA treated patients with CMML, HMA Venetoclax treated patients with CMML, the response rates approach around 90%, and it's significantly less in patients who have treated with HMA alone. HMA Venetoclax also seemed to lengthen leukemia-free survival, so delay progression to leukemia. But what we really focused on was survival as the primary endpoint. And there, it was surprising that there's no difference in survival between HMA Venetoclax and HMA alone in propensity score match analysis. Separately, we also looked at AML secondary to CMML, CMML after blast transformation, and we found similar results where the response rates were higher, but this did not translate into more survival outcomes, longer survival outcomes. Finally, we looked at patients transitioning to transplant and showed that many patients were able to transition to transplant, and that was a favorable outcome in this group of patients. And also looked at patients who had Venetoclax added on after initial HMA failure or refractoriness, and showed that about a quarter of those patients will get to transplant, and there was responses seen. So I think our abstract really shows that although response rates are improved, that means that may not translate into survival benefits. And further investigations really needed to understand what the role of BCL2 inhibition is, and also try to explore other targets in CMML and AML secondary to CMML.